Good evening, everybody. I hope everybody is having had a lovely Friday. And I wanted to stop in tonight and do a video for you on um, accepting insurance. What are some of the benefits of accepting insurance as a private practice? Hello, Mama and me, MD. Thank you for joining us. And I wanted to, our topic today is I want to discuss and give some tips on accepting insurance as a private practice or healthcare provider and some of the negatives and positives of doing so. A lot of times I hear that some providers don't really like to take insurance because they don't like the way that they're being paid through the insurance carriers sometimes. So I'm going to give a couple tips to combat that, to help you figure out ways that you can combat these issues. My name is Ruby Simmons, and I am your medical billing mentor, and I'm the owner of Blossom Revenue Cycle Solutions LLC, where we believe a provider should not have to struggle between patient care and their revenue. And so I have a question. You said, Mom and me, insurance doesn't cover in home care for moms, and that is my business. Insurance doesn't cover in home care for moms. Okay. I think I'm going to answer that question through a DM. I'll send you a message on that because I want to get a little more familiar with the business that you're running. And I'm sure you probably already did the research, but I would like to ask you some questions just to enlighten myself as well. Oh, I can understand why you may be charging cash, but I want to ask you a few questions. So anyway, thank you. So what I wanted to talk about is, sometimes, as a provider, uh, taking insurance, taking insurance may benefit you, and sometimes it may not. And all depends on what area you're doing billing in, and it also sometimes depends on your licensure. Like uh, Mom and me is having with the type of service she's offering. So, but if you are a provider and the type of service that you're offering is covered by multiple different insurances, some of the things you might want to do for taking the insurance is you want to look at uh, the fee schedules. And the schedules will help you to see, how insurances are paying you. Some insurances you can ask them, email them, and ask them to send you a copy of their fee schedule. But if they don't send you a copy of their fee schedule and you're thinking about getting credentialed and contract with them, um, at the point that you get your email from them and they send you the fee schedule, you always have a at that moment you have the choice to either accept the rate that they're giving you, or you can appeal it. You can negotiate a new uh, fee schedule with them before you sign the agreement to be covered, um, to be contracted with this particular insurance. And that benefits you if you are not happy with the fee schedule that the insurance is giving you um, for this particular insurance. And yeah, the insurances do determine the rate um, that you're getting paid for your specific field or specialty. But if you do some research on what they're offering for your specific specialty in the area that you're living in the region that you're living in, you can determine whether it's feasible for you to build uh, this type of insurance for your business. One of the things, though, you do if you decide not to take that specific insurance is you do leave out a number of patients in your area that may use that insurance. And that could decrease how fast your caseload builds up. You build up your caseload because you're limiting yourself to the type of insurances that you accept. Um, and then what it also does is it limits you on certain doctors referring patients to you, and it also limits you in getting some free marketing through those particular insurance carriers because they put you on their list of providers that take the insurance. And when the patient is searching for a particular doctor to take in their area, or the insurance may send the patient a list of participating providers, uh, then you limit yourself on that marketing because you're not on that list. And those are some of the things that's beneficial when it comes to taking insurances. And on top of being able to possibly negotiate a higher rate with them so that you feel like you have more of a livable rate. And if you're a practice that wants to grow and add additional providers to your private practice, you'll be able to pay them a living wage. And those are some of the things that you can do when it comes to dealing with insurance carriers and taking insurances. One of the other things that comes up is denials. Uh, some providers don't, they really don't like receiving the denials, and they don't like working the denials. Excuse me. And dealing with denials is just not attractive to some providers if they're going to do their own billing. So one of the things I suggest, if you don't like getting rejections or denials from the insurance carriers, is keeping track of the type of denials that you get from the insurance carriers and creating a spreadsheet by putting the insurance, the type of denial that you're getting, basically the name of the denial and the explanation of what they give you as to what the denial is. And sometimes it's not as easy to understand the denial given, and you have to call the particular insurance and ask a rep, what does this denial mean? If you put all of that in a spreadsheet, and once you follow up on it and you figure out how to fix that denial, you notate that in the spreadsheet next to that specific denial in the description. The next time you get that denial, you'll know why you get that denial and you'll know how to fix it. So it takes you a lot less time to fix that denial or a rejection that you're getting from the clearinghouse. You would do the same thing. And if you don't know the difference between a rejection and a denial, A rejection comes from the clearinghouse, and a denial comes from the insurance. You don't get a denial until the clearinghouse actually sends the claim. It crosses through your system into the clearinghouse, through the clearinghouse to the insurance. That's when you'll get the denial. The rejection comes when your claim crosses from your system through the clearinghouse and it stops right at the clearinghouse. And most of those are eligibility denials or um, denials that might say the effective date isn't correct, or other things like maybe you're billing the patient's name wrong, or um, you may be billing a code that needs a modifier. And it all depends on the clearinghouse that you're using. Some clearinghouses are more efficient than others and give you more denial, more rejections than others. Some of them might give you, you know, NCCI rejections, which are usually done at the insurance level. Once it gets to the insurance, and they'll deny it. Some of them will deny it for you, and you can fix it. So that's a way to get around all of the denials, any denials or rejections that you will get. And if you have a system that allows you to put rules within it, you can create a rule within your system, or you can ask the system provider that you're using to help create that rule within the system so that it doesn't just benefit you, it may benefit other providers that do the same thing that you do, and allow you to be able to bill that service more efficiently and effectively so that you can get your money in instead of getting a denial. And those are some of the things I just wanted to go over when it comes to taking insurance as a private practice or a healthcare professional who is billing out specific services uh, for uh, for patients, and they're doing their own billing. Again, my name is Ruby Simmons, and I'm your medical billing mentor, and I'm the owner of Blossom Revenue Cycle Solutions, LLC. And we currently have a holiday sale that is going on until the end of this month. If you have any issues with your practice, or as an agency, as a medical billing agency or a healthcare professional within your department, you can get sessions through this sale uh, that where I can assist you in helping you to organize your business or your department, and show you what you need to do in order to fix certain things to build up your practice and to increase your patient load. And if you, I'm sorry, what I would like you to do is to click my link in click on my bio and click on my smart bio, and click on my website and sign up for the newsletters and information on any courses that may be coming out. I have also in the sale, I have a list of mini courses that may be able to help some providers understand revenue cycle management. And I will send you a freebie of a booklet that'll help you to organize yourself. And that's about it. Thank you so much, everybody. And I hope that you have a wonderful weekend. And I'm sorry for for all of the stuttering. I have this cough that wants to come up, and I'm fighting it off so I can get through this video. So thank you very much, everybody, for showing up, and you have a wonderful evening.